My name is Carla Vining. I'm a Cumberland University nursing student. I'm here to do my health assessment. I've solicited Julie to help me with this. So we've already sat down and done the detailed medical history, her medications, her allergies, which she has none. And we've done the Snelling eye chart, and she has 20/20 vision. And we've done the whisper test, and she has perfect hearing. So Julie, anytime you become uncomfortable, just let me know, and we can regroup and cover or what we need to do. So for right now, I'm going to go wash my hands and close the door and grab my stethoscope. That was a full hand washing too. So Julie, if you would stand up for me first, just state your first name and your date of birth.
Julie 3/1/89.
And what year is it?
89. Oh, what year is it today? 2014.
Okay, she's oriented. And can you walk to the wall, please, and back for me? Great. She follows directions. She's oriented, I think. Yeah, we're just a little nervous. We did. And so then I'm just going to start the assessment. If you want to have a seat. I'm going to start by inspecting her skin on her face and her upper torso. Her skin looks clear and is a nice brown color. She's not pale. She's not diaphoretic. Her skin, I don't see any lesions or rashes or any kind of scabs or sores. So she's got healthy looking skin on her face. I'm looking at her hair. Her hair is pretty and healthy, and it's moisturized. So, you know, just her appearance, she looks very healthy. So now I'm going to feel her scalp when I'm feeling for any kind of nodules or depressions in her scalp, and I don't feel anything. I'm going to tickle you. Don't fall asleep on me. I don't feel anything. Looking at her face, her eyes are balanced. Both sides of her face is symmetrical. Her lips are plump and moist, and her nose is midline, and her face is very balanced. So I'm going to palpate your sinuses. Do you feel any pain when you do that? Any pain there? No. Okay. Now I'm just going to take a look in her eyes for her pupillary response. If you'll look straight ahead for me. She has good pupillary response. They're equal, round, and accommodate, about 3 millimeters. I'm going to just inspect her ear cavity. And I don't see any drainage, any kind of nodules or bulging anything. Can you, I'm going to look up in your nose. I don't see any kind of drainage. Her septum seems to be midline. And can you open your mouth? I'm just looking at her tongue. It's beefy and pink and very moist. Her teeth are very healthy and white. There's no cavities. And let me just see one. Underneath her tongue is very healthy. I don't see any lesions or sores or anything. Let me go, Don't really see her tonsils, which is a good thing. And her uvula is midline and is normal. Okay? Now I'm going to start by inspecting her neck. I don't see any kind of pulsating or rashes or anything. I'm just going to feel. I don't feel any nodules or bulges. Can you swallow for me? Her trachea is midline. Is there any pain when you do that? No pain. So now I'm going to just feel for her lymph nodes. Her pre- and post-auricular lymph nodes. And I don't really feel anything. Can you raise your arms for me? Can you lift your arms out? It's going to feel. And I don't feel any kind of bulges or Is there any pain there? No. So now I'm going to listen for heart sounds. And I'm inspecting her skin. I don't see any rashes or scars, any discolorations or bulges or anything on her chest area. Her apical pulse is the fifth intercostal midclavicular line. Good, it seems good. Now I'm going to assess her lung sounds. Take a deep breath. Again. I don't hear any rhonchi or wheezes or any adventitious sounds that shouldn't be there. Do you have any trouble, any shortness of breath or anything like that when you breathe? Mm-hmm. Exertional shortness of breath when you're walking around? Great. Now I'm going to go ahead and ask you to stand up for a second. I'm just going to look at your back and assess your lung sounds back here. Her back appears there's no rashes or nevi or scabs or anything on her back, and so I'm going to listen for her lung sounds back here. Just take a breath for me. I don't hear any wheezes or rhonchi or crackles or any adventitious sounds. While I have you standing here, I'm just going to assess her spine. If you could just lean forward. This is very important to do on especially young girls and men. You do see this a little bit on men, but not often. But her spine is midline. There's no pulling to one side or the other. And everything looks good and appears normal back here. Okay, if you want to stand up for me. I'm going to continue to just assess her diaphragm and the rise and fall of her chest. If you could just breathe in for me. And again. Don't feel anything. I don't see anything adventitious back here. Her shoulders rise and fall as they should, symmetrically. And if you want to turn around and face me again. Now, while I've got her standing here, I'm going to go ahead and assess her balance. And if you want to hold your arms out to your side and close your eyes and touch your nose. Good. And again with the other end. Okay, you can open your eyes. Now lift one leg to your knee and drop. And the other and drop. Great. Great balance. Have a seat again. If you want to lay down, I'm going to go down to the abdomen. So I'm pulling the shirt up. I don't see any kind of rashes or protrusions, which could indicate a hernia. I don't see any pulsating, just to look at it and inspecting it. No kind of scabbing or nothing like that. So now I'm going to listen for vowel sounds and for her aorta to make sure I don't hear any bruit or anything like that. I would listen up to 2 minutes if I needed to. But she's got good vowel sounds. Okay, she's got good vowel sounds and also says the aorta. I hear everything seems normal there. So you have any trouble with elimination, with emptying your bowels, your bladder. So now I'm going to just percuss it along the abdomen. Whoa. She's got good sounds. I don't hear anything abnormal there. No, that's good. Now I'm just going to palpate for quadrants to feel the edges of the liver. I shouldn't feel a bulging liver, and palpate for the spleen and the kidneys, and just palpate her abdomen. And I'm going to go light, and then I'm going to go kind of deep. Just feel the edges, and she's so thin and healthy. You can really feel her edges. No pain. I don't feel any protrusions or bulges, and everything appears to be normal. How about your bladder? We did have her empty her bladder before the test started, so she's a little goosey, so that she's got good responses there. So now I'm going on to the legs. So I'm inspecting her legs. Well, let's start with the arms before we go any further. I'm just going to take a look at her arms. Her skin looks healthy. I don't see any rashes or scabs. I don't see any nevi that need attention. Her hands look healthy and normal. Her nails are very well groomed and clipped short. Just going to look at her capillary refill is less than 2 seconds there and there. Inspected her arms all the way down, and they look very healthy. I'm going to check her radial pulses. And they're very equal bilaterally. Rhythm is regular and regular rate, it appears to be, which we collected her vital signs in the beginning, so and all her vital signs were normal. So we're going on down, looking at the legs. I don't see any kind of rashes or scabs or any kind of areas that need attention on her skin. So I'm going on down to her feet. I'm going to assess her pulses on her feet, her pedal pulses. And they are very equal and bilateral. They're healthy, regular rate and rhythm. Very regular and equal bilateral pulses. Now I'm just going to check her strength, and equally, if you can press my hands and pull up. Great. Same thing here. Pull. Great. Yeah. Pull. And lift up and down. Great. She's got good strength there. If you want to go ahead and set up for me and turn around. I'm finished with the exam. Go ahead and get dressed. I'm going to step out, give you some privacy, and then we'll go next door and discuss the findings. Thank you.